Hello, this is Fundamentals of Case Management Practice. Chapter 21, Preparing for a Service Planning Conference. A service or treatment planning conference. A treatment or service planning conference is a meeting in which professionals get together to discuss new cases and make decisions about how to handle each case. The meeting involves professionals collaborating together to determine what is best for the client. You need to bring to the conference your tentative service plan for the client you are presenting, a human service directory, or at least a good long list of community resources you know about in your DSM handbook. Goals for the meeting. Goal number 1, diagnosis. Any number of people seeking assistance do not have or need a diagnosis. However, there are diagnoses that may apply to many groups, such as for older people, children with developmental issues, trauma victims, or substance abuse and mental illness. Goal number 2, level of case management according to the abilities of the client and the degree to which the problems are interfering with functioning. You assign a level of case management from intense to least intensive. Goal number 3, services to be given. A plan for the client is developed, which includes what referrals will be made, the planning based on your presentation of the client. We'll consider the client's strengths and expectations. Collaboration. Meeting with staff to determine a final plan and diagnosis is a collaborative process. Expect to answer questions, expect to receive suggestions from others. Do not expect that the plan you have in mind will be the final plan. Preparing to present your case. The elements of your presentation should include why the client came to the agency, the presenting problem, how the client presented in the assessment interview. Here you discuss such things as the client's attitude, participation, thinking, and concerns. What the client indicated are his or her goals and expectations. Additional relevant information that may have a bearing on your disposition of the case. Your impressions and recommendations. Making the presentation. Be prepared to talk to the team for at least 3 to 5 minutes. You should be able to talk about the client without a lot of notes, but it is all right to use notes to give you details you don't know offhand. The team should always ask you questions about the client. Be prepared to answer questions about your client from other team members. These members are a collaborative activity. Ask questions of others in a collaborative and respectful manner. Remember, you have not seen the other clients the presenter has. The follow-up after the meeting. Following the treatment or service plan conference, write up a formal service or treatment plan. Meet with the client to discuss the plan. Make sure this is what the client wants. You may need to make a few minor adjustments to the plan. Make referrals to the provider agency where the client will receive services